Hello, everyone. My name is Mike Brody, and I'm the Manager of Programs for the Kidney Foundation in Lethbridge. Welcome to Am I at Risk? Kidney Health for Everyone, presented by the Kidney Foundation of Canada's Southern Alberta and Saskatchewan branches. This evening, we're going to hear from nephrologist Dr. Joanne Koppel, a kidney doctor from Saskatchewan, and Cyril Muse, who will be sharing his journey with kidney disease. Before we begin, we would like to recognize the Indigenous land that we are on, inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada. Land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I encourage everyone to take a moment to reflect. If you know the territory in which you are situated, I invite you to acknowledge it in the chat. I acknowledge that I live and work on the lands of the Blackfoot people of the Canadian Plains and pay respect to the Blackfoot people while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. We respect the continued connection with the past, present, and future in our ongoing relationships with Indigenous peoples across the country. Did you know that 1 in 10 Canadians has kidney disease? Because there are no symptoms until kidney disease is quite advanced, many people aren't aware that they have the disease until they've already lost most of their kidney function. That's why it's so important to know the risk factors for kidney disease. I'd like to now introduce our first speaker, Dr. Joanne Koppel. Dr. Koppel is a clinical professor of medicine in the Division of Nephrology at the University of Saskatchewan. She is currently the Saskatchewan Physician Lead for Kidney Health and the Medical Lead for the Chronic Kidney Disease Clinic Community Health Program for the Saskatchewan Health Authority. She is the chair of the National Programs and Public Policy Committee of the Kidney Foundation of Canada and a board member and medical advisor for the Saskatchewan branch of the Kidney Foundation. She is also one of the co-chairs of the CanSolve Knowledge User and Knowledge Translation Committee. Thank you, Dr. Koppel.
Thank you, Mike, for that kind introduction. Can everyone hear me?
We can hear you, Dr. Koppel.
Okay, thank you. So thank you, Mike, for that kind introduction. So through a series of questions over the next 30 minutes or so, I hope to answer some of these. And we're going to talk about what are kidneys, how do they work, what is chronic kidney disease, what causes kidney damage, how would you know if you are at risk for chronic kidney disease, what tests should you have to tell you that you have chronic kidney disease, and what should you know about chronic kidney disease, and how should you keep them healthy? And if you have been told about chronic kidney disease, what can you do about it? So what are the kidneys? Well, really, the kidneys are sophisticated trash collectors. Normally, you have two kidneys, right and left, located under your lower ribs, and they're about the size of your clenched fist. This is a picture of the kidney anatomy, and each kidney is made up of 1 million nephrons, and nephron is just the medical word for filtering unit. So you have about 1 million nephrons in your right kidney and 1 million nephrons in your left kidney. And that nephron or filtering unit is made up of a glomerulus, which is this red ball of blood vessels here, and this series of tubes. And it's really where the glomerulus and the series of tubes are where all the action is. Waste products such as creatinine, which we'll talk about in a minute, water, salt, drugs, and other minerals are filtered through this glomerulus. They enter the tubules, and the tubules then do reabsorb what the body needs. So those tubules will reabsorb water if you need water. They'll reabsorb salt if you need salt. They'll reabsorb other minerals if that's what you need. And all of that work by that glomerulus and those set of tubes is done through a very complex and highly organized process. The final product then that comes down this collecting duct and then into the pelvis of the kidney is then the urine, and that urine goes down through another tube called the ureter into the bladder, which is really a sophisticated elastic storage depot. And then when the bladder is full, it's eliminated from the body through another tube called the urethra. So the kidneys are fascinating organisms. So how do they work? Well, they do really 4 main jobs. Those filters do remove the wastes from your blood, and the wastes are formed from the work that your body does. One of the waste products the kidneys remove is called creatinine, which is a waste product of muscle work. Creatinine is a very useful blood test as it tells us how well the kidneys are working, how well those filters are filtering out that waste product. A high blood creatinine means that the kidneys are not working very well. The second job of the kidneys is to keep important minerals in very tight control. And those important minerals include things like potassium, calcium, phosphorus, and sodium, or salt. The third job of the kidney is to regulate the amount of water in our body. So if you have too much water in your body, the kidney gets rid of it. If you don't have enough water in your body, the kidney tries to reclaim as much water that was filtered by the glomerulus as much as possible. And then the fourth job of the kidney is to produce hormones. And hormones are chemical messengers. The kidney produces hormones that help produce red blood cells. That hormone is called erythropoietin, or EPO for short. But the kidney also produces other hormones that regulate your blood pressure and other hormones that actually keep your calcium in balance as well. So then what is chronic kidney disease? Well, if those filters in the kidneys are damaged, then they don't do their job very well. So they're unable to remove all the wastes from your blood. And so remember that creatinine is one of those waste products. So if the kidney filters cannot remove all the creatinine, then the blood creatinine goes up. And this tells us that the kidneys are not working very well. If you have chronic kidney disease, then those important minerals are not in balance. So the potassium may be too high. And if it is very high, this can actually stop your heart. Calcium and phosphorus levels may be out of whack. And this then can lead to bone and blood vessel problems. If the filters are not working very well, then they can't get rid of that extra body water. So the body water increases and people become swollen. And sometimes you may have so much water in your body that you become short of breath. And then the fourth job that the kidney is doing is producing those hormones. And if the kidneys are not working very well and those tubules and those glomeruli, those filtering units are not working very well, then those hormones are either produced too much or too little. And if they're produced too much, then your blood pressure goes up. If they're produced too little, then you become anemic or low in blood. And that's when you feel tired and cold, etc. So the official definition of chronic kidney disease is kidney damage or decreased level of kidney function that's present for 3 months or more. So it's very important to remember that the definition of chronic kidney disease is that 3 months or more. If your blood creatinine was up and then came down, and within that 3-month interval, then you do not have chronic kidney disease. You had an acute increase in your, or an acute decrease in your kidney function that got better. That's called acute kidney injury. So what causes kidney damage? Well, there are 2 very common causes of chronic kidney disease. And number 1 is diabetes. And number 2 is high blood pressure. And in those 2 conditions actually cause about 75% of the causes of people who are on dialysis. But there are other causes of chronic kidney disease as well. They're less common. Two causes that you may have heard of course, are polycystic kidney disease, or PKD. And this is an inherited or genetic cause of kidney disease. And the kidney filters that I showed you are squeezed by the growth of many kidney cysts or fluid-filled sacs. So eventually they become scarred and can't work very well. One of the other causes of chronic kidney disease is something called glomerulonephritis or nephritis. And the filter of the kidney becomes damaged because something's attacked the filter, like an infection like hepatitis C, or the body attacking itself, like in a condition called lupus. So how would you know if you were at risk for chronic kidney disease? Well, the major risk factors are, of course, what we just talked about, diabetes and high blood pressure. But people who have a family history of kidney disease are also at risk for chronic kidney disease. People who have blood vessel disease, so if you've had a stroke or a mini stroke, or if you've had a heart attack, or have had angina or heart failure, or if you've had toe or leg amputations, all of that means that you have blood vessel disease. And you have about 60,000 miles of blood vessels in your body. So you can see that blood vessel disease can affect, obviously, any organ of the body. So if you have blood vessel disease, you are at risk for chronic kidney disease. People who smoke are 2 to 4 times more likely to have chronic kidney disease than people who do not smoke. And if you chew snuff, it's exactly the same. And there are people of certain ethnic groups, such as First Nations, Métis, and Inuit, Asians, Hispanics, or Africans, that are at higher risk than Caucasians for chronic kidney disease. And that's because diabetes and high blood pressure are more common in those ethnic groups. And so it's through that mechanism of diabetes and high blood pressure that they're more at risk. So how will you know? Well, why don't you go to the Kidney of Canada Foundation website and take the 10-question quiz that will tell you whether or not you are at risk for chronic kidney disease. So you can go to the website, or you can use that handy QR code that is on the slide there. So what tests? So you have some risk factors for chronic kidney disease. So what tests should you have to see if you actually have chronic kidney disease? Well, I think there are 3 simple tests. One is a blood pressure check. Some people would argue that that's not a test, but a blood pressure check is still a test. Because if you have high blood pressure, you're more likely to have chronic kidney disease. So that should always be tested. The second test, of course, is a blood test for that blood creatinine level. Because remember, creatinine is the waste product that builds up when the kidney filters are not working. So from that blood creatinine level, we can also calculate the percentage of our kidney function. And that calculation is called the eGFR, or in medical speak, estimated glomerular filtration rate. Glomerular filtration rate is the rate at which the filters are removing the waste products. So maybe in the clinic, somebody will say to you, you have 45% kidney function. So that's what we mean by the glomerular filtration rate. And the third test to decide if you have kidney disease is a urine test. And what you're testing the urine for is protein. Because if you have protein in the urine, that means that the kidney filters are damaged and are leaking protein from the blood into the urine. So these are simple tests. You're not having to have CT scans or MRIs or anything like that. These things are available in any primary care provider's office. So what should you know about chronic kidney disease? And Mike mentioned this, that chronic kidney disease is quite common. 1 in 10 Canadians have some form of CKD. And the problem is that chronic kidney disease can be very silent. In fact, most people will not develop any symptoms until 70%, sometimes 80%, and even sometimes 90% of kidney function is lost. So you have no symptoms, so it's very silent. And if the filters of the kidney are chronically damaged, they unfortunately cannot heal themselves, unlike the liver. If the liver cells are damaged, they can actually heal themselves, but the cells in the kidney cannot do that. So what else should you know about chronic kidney disease? Well, you should know that CKD increases the risk of death from heart attack and stroke. And so it's very important then to know if you have CKD so that you can reduce your risk factors for heart attack and stroke. The other thing you should know, of course, is that chronic kidney disease can lead to kidney failure, or again, in medical speak, what we call end-stage kidney disease. And a person who's at increased risk on this diagram can develop kidney damage. So then those kidney filters are chronically scarred, can't get better. And that kidney damage can progress to reduced kidney function, which then can progress to kidney failure. But in this story, the good news is that only about 3% of people with chronic kidney disease will progress to complete kidney failure. So that is the good news. One of the good things to take away if you have chronic kidney disease. If chronic kidney disease is detected early, there are treatments that have been shown to slow or sometimes even stop the decrease in kidney function. And these treatments are widely available. Sometimes they're cheap, sometimes they're not so cheap. But if we can slow or stop the decline in kidney function, then the risk of heart disease and stroke will also decrease. So what should you do to try to keep your kidneys healthy? Well, the biggest thing that you can do, and one of the most important things that you can do to keep your kidneys healthy, is to have your blood pressure in the normal range. And most people should have a blood pressure that's less than 140/90. And now most people are recommending that if you have diabetes, that your blood pressure be 130/80. And in a recent publication, people who are at high risk, so those are people greater than the age of 50, people who have had heart attacks or strokes, that we try to aim for a blood pressure as low as 120/80. So blood pressure is one of the most important things that you can do to keep your kidneys healthy. But everybody has their own individual blood pressure target. So you need to ask your primary care provider, your family doctor, your nurse practitioner, what the target blood pressure is for you. And there are many ways of controlling your blood pressure, including eating a healthy diet, exercising regularly, limiting salt, stopping smoking, and reducing stress through relaxation techniques and taking medications as prescribed. The second thing that you can do to keep your kidneys healthy is to lower that salt intake, and to lower it to about 2,300 milligrams or less per day. 2,300 milligrams of salt is 1 teaspoon of salt. And the salt shaker is not really the problem. It's the salt that's hidden in foods that is really the issue. So it's very important for you to learn how to read food labels. And so you should choose products with less than 10% of the daily value for sodium. Those products then are low in salt. The other thing you should do is eat more fruits and vegetables. So a Mediterranean type of diet, which has lots of fruits and vegetables, has been shown to lower blood pressure, which then of course will keep your kidneys healthy. You should get off the couch and be as active as you can. If you have trouble with mobility, chair exercises can be helpful. Activity will help your blood pressure, will help your blood sugar, will help your breathing, will help your heart function, will help you sleep better, will help your mental health, and certainly can also help decrease your weight a bit. So blood pressure, lowering salt, eating more fruits and vegetables, getting off the couch. The other things that you should do, of course, is to stop smoking or vaping if you do those things, because as we said before, smoking increases your risk of chronic kidney disease by 2 to 4 times. And if you have diabetes, you should try to keep your blood sugars within your target range. The same as blood pressure, everybody has a target range for their blood sugars because everybody's conditions are different. So everybody has a different target blood pressure and a different target blood sugar. So you should ask your doctor or your nurse practitioner about what your target blood sugar should be. And you should also ask them how often you should check your blood sugar, because not everybody needs to check their blood sugar every day. As we said, losing a bit of weight, if possible, will help both your blood pressure and blood sugar control, which will then help keep your kidneys healthy. So kidney disease is more likely to develop in obese people even without high blood pressure or diabetes. So people who are overweight or obese have a 2 to 7 times more risk of developing end-stage kidney disease. So what's the definition of overweight or obesity? Well, the Center for Disease Control and Prevention, so the CDC in the United States, defines this as weight that is higher than what is considered healthy for a given body height. So this is where people come up with that body mass index, or BMI. But remember, BMI is just a screening tool. It doesn't really tell you where your total body fatness, because a person may be considered overweight or obese, but still be in a relatively good health. And where you carry the weight is sometimes more important. So if you carry the weight around your gut, that increases your risk of diabetes, which then increases your risk of chronic kidney disease. And if you have bladder infections, particularly if you have diabetes, those should be treated quite promptly, because sometimes a bladder infection can actually black flow into the kidney, and then you will develop a kidney infection, which then can cause chronic damage to the kidney. So if you have diabetes and you have symptoms of a bladder infection, that should be treated fairly promptly in order to keep your kidneys healthy. The other things that you should do is to be really careful about using over-the-counter medications and herbal remedies. And so some of these are what's called non-steroidal anti-inflammatory drugs, or what we call NSAIDs. And examples of those are Advil, Motrin, Naproxen, Aleve. They can cause chronic damage to both that glomerulus as well as the tubule, so they can damage the entire kidney filter. Ristocolic acid is a herbal medication that's often found in herbal remedies that causes direct damage to the kidney. Some decongestants, such as Sudafed, can cause damage to the kidney, especially if your blood pressure is very poorly controlled. So if you need a decongestant, you should ask your pharmacist what's good for you if you have chronic kidney disease. And use of herbal supplements may not be safe for people who have chronic kidney disease. What might be safe for a healthy person may not be safe for someone with chronic kidney disease, and in some cases can be downright dangerous. Herbal supplements are not regulated, so you have no idea what is in them. And some herbal products have actually been shown to contain arsenic, mercury, and lead, all of which are quite toxic to the kidney. So you should always check with your pharmacist or your primary care provider if a herbal supplement is safe. One of the best herbal websites that I've come across is www.medlineplus.gov. That is an excellent website for medications in general, but it has a wonderful tab about all the complementary herbal medicines that I've ever seen. So if you want to go to that website. Don't go to Joe's website about herbal medicines, because that's probably not correct. And so the other thing you could do to keep your kidneys healthy is, if you have risk factors for chronic kidney disease like diabetes, high blood pressure, family history, you should get your kidneys checked regularly. Because if you find you have chronic kidney disease early, you can treat it early and perhaps slow or prevent the decline in kidney function. So someone's told you that you have kidney disease. So the goal, our goal together, as you as the person with kidney disease and me as a kidney doctor and your family physician or your nurse practitioner, our goal is to try to slow or perhaps decrease or to perhaps stop the decrease in kidney function. And to do this, many of the same things you're doing to keep your kidneys healthy will also slow or perhaps stop the decrease in kidney function. So you want to control your blood pressure. Remember, less than 140/90 or even lower, depending upon your personal situation. Controlling your blood sugar if you have diabetes. Again, what is your target? Ask your primary care provider. Be as active as possible. limit your salt intake to less than 2,300 milligrams per day, stop smoking or vaping or chewing snuff, and have your kidney function checked regularly or as recommended by your doctor. So what else should you do? So, 3% of people, if they have chronic kidney disease, will progress to end-stage kidney failure. We can't ignore that. So if your kidney function is decreasing, despite everyone's best efforts, then you should learn about your treatment options for kidney failure early. Don't wait to the last minute, because people who are educated about their declining kidney function and educated about their options for the treatment of kidney failure have been shown to have better outcomes and better health. So don't put your head in the sand. You've got to know about what those options are. So I think it's important to address knowledge gaps about kidneys and kidney disease. Not knowing about kidney health actually increases kidney disease and ultimately increases more illness and more death associated with kidney disease. We should not only be aware of the vital role that kidneys play in our body, but we should know what our personal risk factors are and what to do about them. So I hope in this very short presentation that any knowledge gap that you've had has been addressed. And I believe we have some time for questions, or I have time for questions at the end. I will leave that up to Mike. Thank you, everyone.
Thank you, Dr. Koppel. We do have time now for a couple of questions, but we will also have more time for questions at the end. So I'm going to ask Jill to come on, and if she can ask a couple of questions from the chat.
Yeah, and just to reiterate what Mike said, we have lots of time at the end, but just a couple right now. Dr. Koppel, we have had a request after you answer this, maybe one particular question, that you repeat the website about the herbal remedies, and we'll even put it into the chat. But someone was asking if turmeric is good for kidneys.
I don't specifically know that actually, but turmeric has been shown to have some really good properties to stop inflammation of the body. So if you can decrease chronic inflammation of the body, then it probably should be okay for the kidneys. So, and certainly turmeric is not harmful. So if you are using turmeric, like turmeric tea or whatever, go for it.
And the website?
So that website, again, it's Medline Plus, and the website is Medline Plus, all one word, .gov, G-O-V.
Okay, perfect. And another couple of questions just related to kidney stones. We've got a couple of more specific questions, but just in general, someone was asking about a lower pole calculus that was been measured. Is it recommended to have it removed? Is there a risk of leaving it? If it's not causing any issues, it's non-symptomatic. Other people just asking questions about kidney stones in general and its effect on kidney disease.
So it's not recommended to remove small kidney stones if they're not causing obstruction, which is blockage of the kidney, or not causing a recurrent pain or blood in the urine. So if a person has a small kidney stone in the lower pole, it would just be recommended to leave it there. But in order to decrease your risk of kidney stones or having that kidney stone get bigger, what you need to do is ensure that you are drinking enough fluids. And the best fluid to drink is plain water with lemon juice. So it's been shown that people who drink lemon juice can actually prevent kidney stones. So, and that the reason being is that there's citrate in lemon juice, and that actually is an inhibitor of kidney stone production. So lemon juice into water, and you should drink at least 3 liters a day. So that's for kidney stones. I'm not saying that if you don't have kidney stones that you should be drinking 3 liters a day. That's actually, that 8 glasses a day thing is a myth, except in the case of kidney stones. In people with kidney stones, they should drink a fair amount of fluids.
Okay, maybe just a couple of others. How often should a person have their kidneys checked, have a kidney checkup?
Well, it really depends upon your underlying health and what percentage of kidney function you have. So if you have risk factors, say you have a family history of kidney disease, but nothing else, you probably should have your kidney function test once a year. But however, if you have a kidney function that's about 30%, then usually people recommend that you have your kidney function done about 4 times per year. So it really depends a lot on your individual circumstances, how often your kidney function should be checked.
Okay, I think we'll continue on, and please keep sending your questions into the Q&A, and we'll have lots of time at the end for more questions. Thank you, Dr.
Thank you.
Koppel.
Hey,
You're
thanks,
welcome.
Doc, and thanks, Jill. Okay, so as Jill said, a reminder that we will have time for more questions at the end. So I'd like to now introduce Cyril Muse. Cyril is a dedicated volunteer in our kidney and transplant community. Cyril has spent 2 decades volunteering at the Kidney Foundation in Calgary ever since his diagnosis of kidney failure in 1998. He received a kidney transplant from his wife, Lori, that same year. He is a passionate advocate for kidney research, prevention, and supportive services for people with kidney disease. Cyril is the current board president of the Southern Alberta branch. Cyril?
Thanks very much, Mike. Good evening, and thank you everyone for attending the webinar. During my time with you, I'd like to provide you with my experiences while living with kidney disease. My first exposure to kidney disease was when I was in my teens. My mother was diagnosed with renal failure. Her treatment at the time was in-center hemodialysis. She spent most of the last 4 years of her life residing in hospital. Dialysis back then was difficult for her to deal with. Kidney machines were the size of a double door fridge. And she experienced overwhelming illness due to the chemical shifts that were occurring in her body after every dialysis treatment. Her life was not very good at all. At that time, there was no diagnosis of the cause of her kidney failure, but she had developed stage 2 diabetes, which was a potential cause. My personal journey began in 1997. I had always been very active and healthy throughout my life, but in the latter part of that year, I began to feel very tired with a lack of energy, a metallic taste in my mouth, and a general overall feeling of unwellness. I was heavily involved in building a small business with a couple of partners that involved many long days and considerable stress. I had been regularly seeing my family physician and previously had no indication that my health was deteriorating. My health hit a low at the start of January 1998. I had visited my physician and was treated for gout that had developed. Part of that treatment was non-steroidal anti-inflammatories. My health continued to worsen, and my wife was very worried. She reached out to the physician that treated her and the children to see if she could provide another opinion. I was raised at the time when you didn't question physicians and trusted their judgment. I took my son to see his doctor for a checkup after a bout of strep throat, and the doctor inquired about my health. She offered to arrange for a series of blood tests and promised to follow up should anything abnormal be found. Thinking nothing of it, I was just overworked and stressed out. Unbeknown to me, the doctor had ordered my blood test as urgent, which required rapid testing and reporting. Once she received the results, she took it upon herself after supper that day to walk a couple of houses down the street to her neighbor, who just happened to be a nephrologist. Looking at the results, he confirmed that she was correct in her assumptions. The very next morning, I received a call from the doctor's office asking me to come in to see the doctor as soon as possible. I remember very clearly to this day, it was a Wednesday morning, and with my busy schedule and the knowledge that the doctor did not work on Fridays, I suggested that the next Tuesday would work best for me. The response I received was, no, I cannot tell you why, but you need to come in today before noon. Many things raced through my head at that time. The kidney disease was not even on the radar. I was then headed to see the nephrologist that afternoon, who confirmed the diagnosis of end-stage kidney disease. My wife's doctor, Barbara Howarth, had my wife's doctor, Barbara Howarth, not acted and reached out to her neighbor, Dr. Naren Scott Douglas, who in turn took immediate action, my life could have turned very differently. I am forever indebted to those two doctors who took it upon themselves to save my life. I had little knowledge of the journey that was ahead of me. My business partner, however, reached out to the Southern Alberta branch of the Kidney Foundation to see what he could gather to provide me assistance. The Kidney Foundation immediately responded and provided me with support materials, education, and personal support to review and discuss my options for living with my diagnosis. I knew that with a young family, I had to find a way to control this disease and live the best possible life for my family and myself. Without the support of the Kidney Foundation, I know that I would have struggled to deal with everything that was coming at me at such a fast rate. One of the things that was offered that I took great value in was the peer support program. I was connected to a gentleman that had gone through a somewhat similar process in his life. And the hands-on knowledge and understanding of what I was going through provided me with the ability to move forward and see the light at the end of what was a very dark tunnel at that time for me. By late January, I had a central venous catheter inserted so that I could immediately begin hemodialysis. I tried peritoneal dialysis. However, after 2 attempts, it was determined that my body just would not tolerate the catheter. In March, I had an arterial venous fistula installed in my left arm to continue hemodialysis. I did not see dialysis as a long-term treatment solution for me. I needed my life to be more flexible and independent. Dr. Scott Douglas pushed to get the required testing performed so that I could be placed on the transplant recipient list. During the early summer of 1998, my sister performed the required testing to see if she would be a compatible donor. She was a perfect match. However, the testing discovered that she was in a pre-diabetic condition and therefore was ineligible to donate. My wife then came forward as a potential donor and the testing began. Having type O blood, she is a universal donor, so that part was a go. We were extremely fortunate to match 2 of the 6 antigens, which made compatibility better. Due to the advancement in anti-rejection medications, transplants can be performed very successfully on individuals with no matching antigens. Thanks to the diligence and efforts by Dr. Scott Douglas and the entire Calgary transplant team, we were able to successfully perform the transplant on October 14, 1998. We emotionally refer to this day as our Kidney Day, my second chance at life. Over the course of the past 23 and a half years, I've been very fortunate to have not experienced any form of rejection. I strongly believe that I must do everything I can to be personally in charge of my health, which includes maintaining a strict medication regime. And by this, I mean always taking the right prescribed medications at the right time. I have set daily alarms on my phone to remind me of pill time. Attending scheduled follow-up appointments and checkups. Getting regular blood work as required and asking and or researching what the meaning of the results are. Regularly checking my blood pressure and understanding what is my normal. I have now developed type 2 diabetes, so I now have to know my blood glucose levels and work to maintain them in my normal levels. For this, I have a sensor that I insert into my arm to easily check my sugar levels. I refer to this as knowing my numbers. By understanding what your results are and how they can affect your health, you can be the strongest advocate of your own health. I encourage everyone to know and manage your own numbers. Unlike how I was raised, I am now a firm believer that everyone needs to learn to ask questions to your physicians and support teams that will allow them to provide you with the information that you need to take charge of your health. I go into every doctor's appointment with a list that I have typed into my phone so that I am sure I don't let something slip. I make sure that all of my questions and concerns are addressed or actions so that I can remain in control. Without the help and support of my family, my team of physicians, and the Kidney Foundation, my journey would have not had the same outcome. They all helped me immensely during the darkest time of my life. As a volunteer with the Kidney Foundation, I encourage everyone to reach out for assistance when it is needed. The Kidney Foundation is the leading resource for those individuals living with kidney disease in Canada, and we will always be there and willing to help. Thank you very much.
Thank you, Cyril, for sharing your story. We have time for a question now for Cyril, if there are any, and I'm going to ask Jill to come on, who's been keeping an eye on the chat. And Jill.
Yeah, Cyril, thanks for sharing, of course. And I think it's a really good example. Every time I hear you speak about something else that Dr. Koppel had said, that it's just so, it can be such a surprise for some people, and they just had no idea that kidney disease was even on the table for them until it's almost too late. So one of the questions, though, and you've addressed it a little bit, but is really around, if someone's in a similar situation or feeling like there might be something going on, but maybe they're not getting some pickup from their care team or their doctor, maybe they don't fit into the traditional profile of someone with kidney disease. I mean, maybe you could talk a little bit more about self-advocacy and some of those things.
Yeah, as I said, I was brought up in the age of where you didn't question doctors. Doctors were all knowledgeable and were always in charge of things. And I learned, unfortunately, that that's not always the case. I'm very, very strong advocate of controlling your own health and managing your health, asking questions. If you're not getting the answers you need, then perhaps second opinions is what is required. It's critical that you manage your care. I learned the lesson the hard way. I unfortunately left decisions to individuals and didn't bother checking up. So, the strongest thing you can do is take care of your own health, is look after yourself, eat healthy, live, and I've taken on this thing that life to me is everything in moderation. So, just take it upon yourself to be in charge of your health.
Thanks, Cyril.
Awesome, powerful, Cyril. Thank you very much. So you people on here have seen Jill and heard her speak, and now I'd like to properly introduce her. So Jill Goth works for us for the Kidney Foundation of Canada. She is the Manager of Programs and Public Policy at the Southern Alberta branch. She'll be sharing some resources and information available to you.
Well, thanks, Mike. And I'd like to take a few moments, though, before we move on to the Q&A, though, as Mike said, to talk about some of the programs and services that the Kidney Foundation provides for people who are looking for more information about kidney health and chronic kidney disease. Although we'll be talking about some of our programs and services that are more relevant to this topic, the Kidney Foundation provides information and programs for a wide spectrum of people, for those who are just curious about kidneys, all the way to people who are receiving dialysis treatment. And you can always visit our website at kidney.ca to find out all of the information, programs, and advocacy efforts that the Kidney Foundation provides. On some of the slides, you'll see some links or QR codes, but all of this information can be found on our website at kidney.ca, or we invite you to contact your local branch of the Kidney Foundation. We're located all over the country, and there are staff just like Mike and myself at every branch, and we're happy to answer any questions you might have. So the Kidney Foundation provides information on multiple topics. Our website at kidney.ca, it's a great hub for lots of our information. And we also provide digital and paper copies of all our brochures, fact sheets, and patient handbooks. Every Canadian diagnosed with chronic kidney disease receives a free hard copy of our Kidney Foundation handbooks through the kidney clinics at the hospitals. And these books are also accessible to everybody in digital format through the website. And again, if you'd rather get information over the phone, just reach out to your local branch of the Kidney Foundation. We're happy to provide you with all the information you're looking for and send you resources via email or pop them in the mail. The Kidney Foundation is pleased to offer an ongoing series of educational webinars, just like this one, that cover a broad array of kidney topics. Some previous topics include keys to kidney health or diabetes and kidney disease. And so you could check those out at kidney.ca to access recordings of all of past webinars. And eventually this webinar will be on that site as well. Another program we'd like to highlight is our Kidney Community Kitchen. Some of you here watching this evening may have been diagnosed with some level of kidney disease, and you've been told by your care team that you have to adapt your diet in some way. The Kidney Community Kitchen is a website that's supported by dietitians. It's free, it's easy to use, and it aims at making food and cooking as easy and fun as possible for those people who've been told that certain foods are off limits. It includes frequently asked questions, a meal planner, and recipes. And you can visit that website at Kidney Community Kitchen, all one word, .ca. We mentioned earlier that there are no symptoms of kidney disease until it's quite advanced, and many people aren't aware that they have the disease until they've already lost most of their kidney function. The Kidney Foundation has developed the online risk awareness tool to determine if you're at risk of chronic kidney disease. By knowing more about kidney disease and the common causes and risk factors, you will be better able to understand how to protect and preserve your kidney function. So again, as Dr. Koppel had said before, after the presentation's over, take some time, a few minutes, to answer the 10 yes or no questions. The answers will help you know if you should talk to your doctor about having your kidney function checked. And the awareness tool is on kidney.ca on our website. And take the time to fill it out and share the link with friends and family. And the Kidney Foundation of Canada really is here for you. At any time, you can call us. We'd be happy to help. And of course, you can always visit our website at kidney.ca.
Awesome. Thanks, Jill. So now we'd like to hear from you. We have 10 to 15 minutes and already have some questions. I invite our panelists to come back on camera. And if we don't get your question, you can always contact your local branch of the Kidney Foundation. For medical concerns, we advise you to speak with a physician. So Jill, do you have some questions for the panelists?
Yeah, we've got quite a few questions. Yeah, and just kind of all over the board here. So what I tried to do is put some questions together just related about things to take to keep your kidneys healthy. So I'm just going to mention a few, Dr. Koppel, and maybe you can mention them. But I think overall people are maybe wanting to know what they can do to keep their kidneys healthy by things to eat and drink. For instance, omega-3 from salmon, drinking warm water with lemon juice in it, different amounts of water with lemon juice in it. Can you comment on some of that?
Okay. So I'll start out with prescribed medications. So there's a group of medications called angiotensin converting enzyme inhibitors, or ACE inhibitors, or angiotensin receptor blockers, or ARBs. So the ACE inhibitors end in pril. So an example, for instance, would be ramipril or perindopril. And an example of ARB end in artin or sartan. So an example of that would be candesartan or olmesartan. And those two groups of medications actually do two very important things. They are blood pressure medications, so they lower your blood pressure, but they have a unique effect in the kidney to decrease the pressure within that little filter unit. If you decrease the pressure in that little filter unit, you keep that little filter unit working for a long time. So one of the medications to slow progression is an ACE inhibitor or an ARB. So if you have high blood pressure, unless there is a contraindication, like you're allergic to it, or your potassium is too high, then you should be on that medication, one of those medications. The other group of medications that are recent medications that have been shown to slow progression or even stop progression are a group called glifosomes. And so examples of those are dapagliflozin, canagliflozin, and empagliflozin. They're actually medications that were made to treat diabetes. They're not great diabetes pills, however. They're much better at treating heart failure and preventing heart failure and slowing and preventing the progression of kidney disease. The problem with these medications, however, is that they're not on every province's formulary for the treatment of non-diabetic kidney disease. They're on the formularies for treatment of diabetic kidney disease, but non-diabetic kidney disease. So say you had a disease called IgA nephropathy, and glifosomes have now been shown to be probably very helpful in that disease as well, but you would have to pay out of pocket for that. So those are two big groups of medications, prescribed medications that are very helpful in slowing progression. The question about omega-3 fatty acids, that might help your blood cholesterol, which may then help your kidneys, but they're not high on the list, I can tell you that. If you ate at least 1 or 2 servings of fatty fish a week, which is probably better for your health than swallowing an omega-3 pill, that's probably better for you. Was there something else? Oh, the lemon juice thing. So it doesn't matter if you drink the lemon juice in cold water or hot water, whatever you like, go for it. How much you drink, though, it really, as I say, depends upon if you have kidney stones. So if you have kidney stones, at least 3 liters a day. If you don't have kidney stones, you drink when you're thirsty. That's the important thing. You drink when you're thirsty. That magic 8 glasses of water a day that lots of people tout is a bit of a myth.
Okay. If you were born with only 1 kidney, do you have more chance to get CKD?
No. And that, again, that's just assuming that you don't have all the other risk factors like diabetes or high blood pressure. But if you have 1 kidney and you're healthy, you are not at increased risk of CKD because you have more, you have 2 kidneys. You can actually survive on 1/3 of 1 kidney very well without being on dialysis. So if you have 1 kidney and don't have any other risk factors for kidney disease, you should be fine.
Okay. So question regarding hemodialysis. How long can a person live on hemodialysis?
Well, I think it depends upon a number of factors. Does this person show up for all their dialysis treatments? Do they take their medications as prescribed? Do they follow the diet? How much fluid gains do they have in between dialysis treatments? And so it depends a lot on some of those factors. But speaking from a person who's been practicing nephrology for more than 30 plus years, I've seen a patient on dialysis 28 years, was on dialysis for 28 years.
Okay. What's the ideal blood pressure after a kidney transplant?
That's another good question. So the ideal blood pressure is definitely less than 140/90. And depending upon what other things you may have you developed diabetes after transplant, for instance, you may want it to have a little lower. But again, it's very individualized because if the artery, which is the blood vessel that is attached to the artery in your pelvis. If that kidney artery is a little bit narrow, sometimes we would like to have the blood pressure a little higher so that that transplanted kidney gets the blood supply that it needs. So again, very individualized depending upon your individual circumstances. But 140/90 seems to be the blood pressure that lots of people achieve.
Okay. And same thing again, another one about levels. We were talking about GFR level before. So what level is okay and what is too low when it talks about GFR or your kidney function level?
Okay. So there are several stages of chronic kidney disease, and if you have 100% kidney function, and you have stage 1 kidney disease, that means that your kidney function is normal, but you have kidney disease because maybe you have had a microscopic amount of blood in the urine, or you have some cysts in your kidney. If you have stage 3 disease, that means that your kidney function is anywhere from 30 to 59%. And stage 3B is from 30 to 45. That's where you want to really concentrate on methods of slowing the decrease in kidney function. Stage 4 disease is less than 30% to 15%, and stage 5 disease is less than 15%. Stage 5 disease we sometimes call end-stage kidney disease, but people don't usually start dialysis or need dialysis unless their kidney function is about 6%, to be quite honest. So when do you worry about it? Well, again, depends upon your individual circumstances. Sorry to be so wishy about that, but there's no black and white when it comes to your health. A lot of things are sort of in that gray zone. So if your kidney function is stable, then 30% is great. Or if your kidney function is stable, then 25% is great. But if your kidney function, say 59%, but you've been decreasing by 5% a year, well, then that's not so good. So at 59, then that's be something that I would worry about. Whereas if you were stable at 30 or 25, I wouldn't worry. I wouldn't be so worried about that. So again, it really depends upon what's going on in the rest of your health and the rest of your body.
Well, and I'm going to ask this actually another question that just came up related to this, I guess, is so the question is, besides family doctors, who are the specialists who we can turn to and when do we turn to them? So I think that's a little part of when do you see the specialist and how do you access them?
Well, there are referral guidelines to kidney doctors, and the referral guidelines are dependent upon a number of things. For chronic kidney disease, if you have less than 30% kidney function, you probably should be seen by a kidney specialist. And sometimes if you're stable, you might only see that kidney specialist once, and then your care will be returned back to your family physician. If your kidney function is declining more than 5% a year, you should be seen by a kidney specialist. If you have blood and protein in the urine, you should be seen by a kidney specialist. If you have acute drop in your kidney function, you need to be seen by a kidney specialist. So there are, again, multiple referral guidelines that most family physicians actually know about, or they have access to on different websites.
Okay, thanks. Just a question here related to kidney cancer. If someone has stage 1 kidney cancer, is it better to have the kidney removed right away?
Well, kidney cancer is not the expertise of a nephrologist. Kidney cancer is the expertise of a urologist. So a urologist is the person that takes care of the kidney urinary tract and does all the surgical stuff. And a nephrologist does all the medical stuff like the dialysis, et cetera, et cetera. So that question's probably better referred to a urologist than myself.
Okay. All right, so here's a question just related to bladder infections. You had mentioned them before, Dr. Koppel, and that you, the person saying here that you had mentioned that special attention to be taken of bladder infection if a person is diabetic. But if someone is not diabetic, do they still need to run out to get antibiotics at the first sign of symptoms? This is like bi-monthly, thanks loads. So someone's maybe getting quite a lot of bladder infections.
Well, sometimes the symptoms of bladder infections are not actually due to an infection, particularly in an older woman. And if the older woman is perimenopausal or postmenopausal, it actually can be, those symptoms can actually be attributed to something called atrophic vaginitis. And so the treatment for that is not antibiotics. The treatment of that is actually maybe hormone treatment. So people should actually find out if they actually have a significant growth of bacteria in their urine. And sometimes you don't actually need antibiotics, particularly if you're not diabetic, by simply increasing your fluid intake. So the more you pee, the more you get rid of those little, crusty bacteria in your bladder, and you get rid of it without taking an antibiotic. Some people say that cranberry juice will be helpful in trying to decrease the number of bladder infections. The evidence is sort of vague about that. For some people it might work, for some people it doesn't. I think that part of the problem is if you're having cranberry juice, you tend to drink more because it's too sweet.
Mm-hmm. Actually, there wasn't a question, someone asking specifically about tart cherry juice, if that's something. So another question about things to take that might either help prevent or infections or your kidney function.
Well, tart cherry juice has actually been used as a treatment for gout.
Hmm.
Yeah.
Okay.
So not as a treatment, as far as I'm aware, anyway, for infection, but it has been used as a treatment for gout and has been actually somewhat successful.
Great. I think we only have one more question here. Just a reminder, if someone does have another question, if you could type it into the Q&A box at the bottom. So this is a two-parter, and I think Mike and I can answer the first part. And we'll leave the second part to you, Dr. Koppel, but it's related to kidney transplant and immunosuppressant medication. This is someone who's actually had a transplant for 33 years, which is amazing, but struggling over the last 7 years with the side effects of many, many years on immunosuppressants. And the first question, are there other long-term transplant patients to connect with so that we can support each other? Mike, would you like to answer that question?
I would. Thank you, Jill. So the Kidney Foundation across Canada offers a program called the Kidney Connect Peer Support Program. I run that for Southern Alberta. So if someone wanted to reach out to our program, you can look on the website, get our toll-free number. The call would come to me and I would match you up with one of our trained volunteers. And this goes across Canada wide. It's a very, we recruit and train volunteers, and these are people living well with kidney disease, are ready and able to, willing and able to share their story.
Yeah. So yes, please reach out to us, and we'd be happy to help you. And the second question is related to this is, so you might not know the answer to this, Dr. Koppel, but how much, if any, research is being done about the long-term side effects from immunosuppressant medication and what to do about it?
Well, specifically, I don't know of any research about the long-term side effects of immunosuppressant drugs, but every program, though, does collect side effects from the drugs. And so then that sort of stimulates research if there's multiple programs have the same questions. I think that there are new anti-rejection medications that are being developed every day. Well, maybe not every day, but fairly often. And so that hopefully some of those long-term side effects that the participant has been experiencing will no longer be a problem for future transplant candidates. But that doesn't obviously help the participant who has these side effects now. And but having a transplant for 33 years is truly an amazing accomplishment. And I hope that some of those side effects are able to be managed for that individual.
Okay, a couple more. Is there any relation between kidney transplant and pancreas related problems?
Can you repeat that question, Jill? Sorry.
Yeah. Is there any relation between a kidney transplant and pancreas related problems?
Not as far as I'm aware. No.
Okay.
I'm assuming that the person is meaning in a person that doesn't have diabetes.
Okay. Question someone had, just mishearing or not quite clear, just asking Dr. Koppel if you had said that people with kidney stones should drink 2 to 3 liters of water a day. Is that something that you said?
What I said is that people with kidney stones should be drinking 3 liters of water a day.
Okay. Oh, I just saw here, and I apologize, Cyril, your hand was raised related to the anti-rejection question. I apologize. I can't see the video part here. So please pop in and if you had a comment about that.
Yeah, I found over 23 and a half years that I've had some changes to my drug regime. And there are some of the drugs that are some of the transplant medications that I don't tolerate well. So I think it's a matter of working with your transplant team and your support and the support network to investigate if there are things that you are taking that might need to be tweaked a little bit. I can be very honest. There's a couple of the medications out there that I just cannot tolerate whatsoever.
Mhm.
So, I think each and every regime is different for each and every person because we are individuals. So I encourage you to reach out to your transplant team and ask the questions. It's always, like I've said before, I'm an advocate of firing out the questions and getting the answers that you need. So that's what I would encourage you to do.
Well, we have a question, actually, it's kind of related to that here, but maybe from both of your perspectives. Someone's mentioning that their doctor is reluctant to have them tested for kidney disease, even though they're worried about their kidneys and they have pain in the kidney area and the uncle has had a transplant and they feel like they're at risk. Should I be pushing more to get tested? Interesting from a person living with kidney disease perspective and a medical professional's perspective.
Cyril, go ahead.
I would, once again, I would ask the question of why. As Dr. Koppel has mentioned, there's some very simple tests for kidney disease, and your creatinine is the biggest one, and it's the first sign that occurs. I had very high creatinine that escalated very quickly, so it's a good sign. And I think it's a simple blood test that can be done with regular blood tests that are being done. So I would say encourage that test to be done just to give yourself the self-assurance.
And so for that individual does have a risk factor for chronic kidney disease, and that's the uncle that's had a kidney transplant. The pain in the kidney area, kidneys actually don't have a lot of pain. The only time that you get kidney pain is usually when you're passing a kidney stone, or if the kidney is blocked for whatever reason. Otherwise, the kidneys are remarkably pain resistant. So, but it's the uncle that's had the kidney transplant that does make that individual at risk. So perhaps this individual should do that am I at risk assessment, and then print out the results and take that into to their doctor and say, look, I have risk factors for kidney disease, and I want to have my blood and my urine tested.
Mhm. I think just about 3 questions kind of came in all at one time. Just a reiteration about how much water to drink if you have kidney stones. People are asking at age of 40 or 70. So maybe just, it's obviously something that's really sticking for people. So obviously people want to do what they can related to kidney stones. So
Right.
yeah.
Okay, so if you're younger, definitely you should be drinking 3 liters of fluid, water, okay? If you're older, so the 70-year-old, if this is, so with the 70-year-old, depending upon what other medications they're on, they should probably be drinking maybe only 2 liters. Because if the 70-year-old is on a diuretic, like a water pill, like say something called hydrochlorothiazide, then you can't, because that's a medication that's used to treat kidney stones as well. So then that individual, that 70-year-old, should not be drinking that much water. Okay. So if people are confused about the amount of water that they should drink and they have kidney stones, and they see a urologist, which is that's the usual person who deals with kidney stones. Nephrologists usually only deal with kidney stones if people have had multiple kidney stones. That would be a question about how much fluid to drink should be directed to that urologist, or if you're seeing a nephrologist, to the nephrologist. Because again, everybody's situation is unique and individual. And as Mike pointed out, we have to be very careful that we're not giving, pointed medical advice to individual problems.
Mm-hmm. Thank you. Yeah, just a couple more questions here. Some people are, just a reminder for some people who have very specific questions to themselves, the medications they're taking. I'm trying to take some and make them a little bit broad, but reminder that if you do have a question that we can't bring forth because it's too specific, please do turn around and go back to your doctor with that question. Maybe this is one. So earlier on, Dr. Koppel, you mentioned medications ending with tan is good for the kidney. And someone here had a brain aneurysm and had it addressed through surgery, and maintaining their blood pressure. The doctor gave them a particular medication, candesartan. But is that okay to take even if the blood pressure is under control?
Yes. Absolutely. So candesartan is one of those Artin pills. That's an ARB. And so that is an excellent medication to take for blood pressure. Yeah.
Okay. Question about exercise. So regular exercise is good for the kidneys and all of the other, our general health in so many areas, as you mentioned, Dr. Koppel. But this person is stating that especially strenuous exercise increases creatinine in the blood. Can you talk a little bit about exercise and how it could be bad for the kidneys in this way in strenuous exercises?
Well, so you shouldn't have your kidney function tested after you've done about a strenuous exercise, okay? That's because the individual is quite correct, is that the creatinine does go up with strenuous exercise. But if your kidney function is normal or near normal, that's okay. Strenuous exercise is fine. It will help your blood pressure, and certainly help your weight and help your mental health. So unless there's other reasons why you should not be doing strenuous exercise, I would say continue to do that.
Perfect. Again, lots of
Oh, there's one thing though. Can I make a proviso with that? So
Please.
strenuous exercise is good, but do not take those protein supplements that sometimes gyms want you to take because you want to bulk up your muscles. Those you should not be taking, because very high protein intake can damage the kidney.
Thank you. Some more water questions about if you don't have kidney stones, how much water should you drink? I think the takeaway for me, Dr. Koppel, is if you're thirsty, drink.
Drink.
Okay.
Yeah.
Okay.
Yeah.
Yeah. All right. And then a couple of questions just about cysts in the kidney. If you have large cysts and the effects of that, could it cause CKD? Could it cause kidney failure?
So as we get older, particularly if we have high blood pressure, we will naturally develop some cysts in the kidneys, and and those are called simple cysts. And some of those cysts can become quite large, but they very, very rarely cause kidney failure.
Okay, great. Can you speak a little bit about transplant steroid-induced diabetes?
Well, prednisone, which is the steroid, can induce diabetes in anybody who takes prednisone. You don't have to be a transplant patient to develop steroid-induced diabetes. So you could be on prednisone because you have that glomerulonephritis, or you could be on prednisone because you have ulcerative colitis, so a gut problem. And so you can develop steroid-induced diabetes. So that's what happens.
Okay. I believe that was our last question. So thank you.
You're welcome. Some very, very good questions. Excellent.
Okay, well, thank you, Dr. Koppel, and thank you, Cyril. So we've come to the end of our webinar, and again, we would like to thank Dr. Koppel and Cyril for taking the time to be here with us tonight. If you'd like to know about upcoming webinars or other events like this, please sign up for the local Kidney Foundation newsletter. You can do so at kidney.ca or contact your local branch. And you'll see a short pop-up or short survey pop up once the webinar ends. Please take a few minutes to fill it out and help us improve our webinar series. We want to thank all of you for attending, and have a nice evening and good night.